Hi, hello everyone, and welcome to the evening webinar for Northeast Ohio chapter. Today we will speak about how to establish a safe business environment and work effectively during COVID-19 best practices. Today agenda, Ohio chapter introduction for 5 minutes, speakers, presentations, and any clarification questions, 60 minutes. We will have 3 speakers. Each speaker will have 20 minutes presentation, and if there are any clarification question, we will ask after the session. Other question, we will ask them on behalf at the second hours. Second hours open discussion, share experiences, questioning and answers for 50 minutes. Closing upcoming events and how to claim your BDUs, 5 minutes. For question, please use the chat feature in Zoom and please keep your mic mute. Special thanks to our sponsors, ABEX Systems, Strategic System, Tech Systems. Welcome new members to Northeast Ohio chapter on September 2020. Congratulations to newly certified leaders on September 2020. Our speaker today, Ronald Arstupka, Director of Office Services at Calfee Helter, Griswold LLB, and Nikki Sharan, Senior Director, IT Service, Delivery American Institute for Research. Stacy Bush, Recruiting Leader, Application Services at Tech Systems. Without taking too much time, I'll turn it to Ronald to start sharing his screen and presentation. Hi, Ronald.
All right. Good evening, everyone. Thanks very much for the opportunity to speak with you and share some of the things that Calfee, Halter, and Griswold has been able to do to hopefully create a safe environment for our folks to return to the office. Calfee is a 117-year-old corporate law firm, full-service law firm, located here in Cleveland, Columbus, Cincinnati, Indianapolis, Washington, D.C., and New York City. Primarily, most of our support services are housed in our Cleveland office. We are in a 115,000 square foot single tenant building in downtown Cleveland. And all of these protocols that I'll talk about here tonight apply to all of our offices, subject to the other offices being in multi-tenant buildings and subject to their own individual rules, regulations, protocols that they may have in place in the different buildings in our different cities. And these plans are a collaboration of different services within the firm. Our CIO, he was instrumental in, his foresight with cloud computing and portable computing really enabled us to have remote work be very successful for the period of time that we were full remote early on through the pandemic. HR, again, helping people navigate their own personal situations, business development, marketing, facilities, that's my primary role with the firm. Our finance services, our own legal counsel, and our firm administrative partner to help lead the charge, so to speak. So let's go into the Calfee building. Again, we're a single tenant building, so we have the advantage of making, we pretty much made all of our own rules here, and could create our own protocols to, try to keep everyone safe using best practices, guidance from the CDC, state and local departments of health, their recommendations, and we've taken a pretty conservative approach toward allowing folks to come back into the office. So initially, coming in, right before we opened back up in around the middle of May, we created a video that I was able to walk through all of these features that we have set up inside the property to keep folks safe. So they knew kind of what was going on because it had been several weeks since anyone had been in the building. So when you enter the building, we have marked the floor for directions. So we're trying to create a pathway for folks to stay distant, social distance, and not gather into groups. So we've got to change behaviors. That's the key to this whole process, is changing regular habits, coming in, everybody chatting around the coffee machine or in the elevators, etc. So you'll see some of these things. So as you walk in, you'll head to a temperature testing station. So we have an attendant on duty. We do this from 7 in the morning till 11 in the morning, so you can enter the building through those hours. And if you need to come in the building off hours, Monday through Friday there, you would have to get permission to do so. So once you get in, you'll go through a health screening. We have some questions that everyone needs to answer on a daily basis, so you have to do this every day when you come into the office. The attendant will take your temperature and log that you've successfully completed this test and this part of your day, and you end up with this cool little sticker that shows that you have gone through the testing. So as you walk around all day, everyone knows that you've completed the necessary step to get into the building. So one of the things, as we are at the ground street level, we have access control at all the entrances to the building. So to get in, most folks are carrying briefcases, backpacks, lunch bags, etc. So it's sometimes not convenient to have your security card. So we have keypad readers that allow you to punch in a code to unlock the doors to come in. Well, clearly this is an area where we can, keep touches down, these surfaces that many people would touch. So we've closed those off, and likely someday we'll just remove them and just make it a key card reader now that behaviors have changed and everyone is used to bringing their security card with them, having it on a lanyard. So we want to make it easy for folks to get in without having to touch a lot of things as you make your way in. So you get to the elevator. So thinking about the elevators, again, you've always got someone that holds the elevator to try to squeeze one more person into the elevator to head on upstairs to your office. So we've limited the occupancy to 2 persons only. So you can see at the elevator button, the call button there in the hallway, and then inside the elevator to remind folks that it's only 2 persons in the elevator. So as the Director of Facilities, I do have access to our security cameras, and this is an area that I'll look at periodically throughout the day, and our security staff is they're right on top of this. So if they notice things that folks are not doing properly, like keeping the limited occupancy in these elevators, they'll let me know, and I'll go back and I'll shoot them a friendly reminder email. 2 persons only, please, in the elevator. So we're trying to, again, maintain that 6-foot distance that CDC, the state health departments, they are recommending to keep everyone safe. Oh, and again, as you walk in through the door, first thing is you have to have a mask. And unless you're sitting in your chair in your office, you have to have your mask on. So a mask is required. We do have signage on the doors as well for that. And in the elevators, one of my colleagues in our Washington, D.C. office, the property manager there, he had told me about a product. They're self-cleaning elevator buttons. And actually this company, Nano Touch Technologies, is the name of the business. You can find them on the internet, find them online, and you can order their covers that you can put on the buttons. You can get sheets of this material. You can put it on door handles. You can actually cover desks, and they're good for about 90 days, and then you just order a new set and replace those. But it helps with the cleanliness in the building, because you can't be everywhere. So you try to do everything you can to create an atmosphere where everything can be clean. In the restrooms, it's another place that, you know, early in the morning or before lunch or after lunch, before the end of the day, you may have a number of people that get into the restrooms as they get ready to leave for the day or head out for lunch. So we have limited the occupancy there to 2 persons only. And inside the restroom, we have closed off areas to, you know, prevent people from being together or close within that 6-foot distance. So, and changing behaviors, lots of signage on the mirrors to remind folks of hand washing, 6-foot distance, keep your mask on. So you've made it upstairs and you've made it to your floor where your office is located. You get off the elevator, and immediately across the elevator, you'll see the signage. CDC has lots of great materials that you can download and print off. We have a great print department. They're able to create all of this stuff pretty inexpensively. We can put it everywhere as visual reminders of 6-foot distance, social distancing, and wearing your mask. We can put these things on the floor, put the signs up on walls. As you go through the corridors, you'll see the signage as well too. Just all kinds of reminders about changing behavior. That's a key to keeping everyone safe. So supplies. We're able to provide our staff with cleaning supplies, plexiglass. It's maybe a little hard to see there, but it's a plexiglass sneeze guard shield. We make available to anybody that wants it to put on their desk. You know, we have created locations for folks to drop things off, so we don't have direct handoffs. We want to keep the areas, you know, free from folks congregating, standing together, talking, chit-chatting while they're collecting mail. So we've created lots of areas that are away from people, like an administrative assistant at her desk. She'll have a drop-off area for mail, FedEx deliveries, or other supplies. It will be separate from her, so you know, we're not handing things off directly to each other. And again, the supplies, cleaning supplies, Lysol sprays, hand sanitizers, all those kinds of things. These are pretty inexpensive ways to, you know, let everyone know that you really support, you know, them being there, and you know, we appreciate that, and we want to keep everybody safe. And it puts a little bit of a responsibility on them. They can keep their areas clean and neat as they would like. So, you know, they run out of something, they just put in a ticket to get a refill, and we take care of that right away. Personal protective equipment. This is another area that we wanted to make sure that everybody had items to keep themselves safe, mask requirements. So we're going to give you a mask. So we gave everyone a mask on their first day back in the office, back when everyone started coming back in May, with instructions for care. So, and we provided them hand sanitizer that we refill for everybody whenever they need it. So no one has to worry about bringing their own materials in, their own supplies in. and we were able to find this little brass key. It kind of looks like a key, but allows you to pull door handles, push elevator buttons, and so you don't have to again trying to keep touch points and surfaces that may normally be touched a lot. We can minimize all of that. So we've made these things available. They were a little difficult to get early on. Everything is getting to be much more available as the kind of the supplies were hard to get. People kind of the hoarding situation that we had early on through the pandemic is kind of settled down, so things are easier to get. So make these things available to everybody. And then this sign that we've had this, actually we had this place, it was late February, we put this out in our lobby, and trying to again remind people to do things a little bit differently to help keep everyone healthy. Our community spaces. We are in a historic building in downtown Cleveland. It's over 100 years old, and we've got some really neat spaces, some historic elements to the grand lobby. It's a 2-story lobby. We have this really nice cafe. There's a fireplace that you can see in the one image there, and we've closed that whole area off. This was, again, another area that every day at lunchtime, folks would gather after being in their offices or their workstations and being busy there. So from around 11:30 to at least a couple hours, it would get very busy. Folks sitting together, chatting, eating lunch, and we unfortunately have to close this off to prevent congregation, and the 6-foot distance becomes really hard to maintain. So at this point, we are still closed and not sure when that might reopen. We do have a small market in our facility. You can get coffee, soft drinks, snacks, sandwiches, and again, the old beehive of activity, so to speak, at the lunchtime. And we've limited that to 2 persons each. And we ask everyone to wash their hands because there's a kiosk for payments, there's coolers, there's snacks on racks, and things that people can have. So we want to, again, change our behaviors and make sure people are doing everything they can to keep the areas safe. Yeah, these spaces were created, intentionally created for gathering, because we knew people would be busy at their desk all day long, but we value the face-to-face interaction. But at this time, we really have to be quite the opposite. As you can see, we have we pulled all the seating out. We cordoned off all the other seating. We have small spaces like this throughout the building that we, unfortunately, at this time had to close off and make they're not available for folks to use, because we don't want them to get groups of people together. We have televisions in these areas. You'd watch the news, sports, things like that, and folks would gather together, and we had to unfortunately eliminate that at this time. Recently we started opening up our meeting space. We had closed those off for some time, but again, this is a table in a big conference room we have in our conference center that typically has 24 chairs around it. We've limited that to 6 to keep, folks can meet face to face, because sometimes you just have to do it in a Zoom meeting. This is great. This actually works very nicely to get folks together, but sometimes a face-to-face meeting is really valuable, but we've limited that. And then we created these little cards to remind everybody, you have to have your mask on. You're not sitting in your chair, so you have to have your mask on while you're having this meeting, and stay 6 feet apart. And throughout the conference center, we typically had food service every day. It was a big event, getting our professionals together in meetings, and that's all been suspended at this time. So you're leaving the building. So we created very similar to what you might have seen in supermarkets or other retail establishments, kind of a flow of traffic, up and down aisles, one way this way, and to limit the face-to-face contact that folks might have. So we have one way in and one way out of the building. So hopefully that, again, minimizes that change in behavior. Usually you get a crowd of people at the elevator in the main lobby waiting for their lunch partners to go head off to a restaurant, and those obviously aren't available at this time. So how much longer is this going to go on? Our pandemic, our masks, our hand sanitizer. We don't really know, but I know we are closely following, again, the health professionals, public health departments. Clearly vaccines are something that's going to be necessary, immunity. So we have to, it's kind of a grind, and you have to stick to it. And I know from time to time folks get a little frustrated, but we have to stick to this. We've been pretty lucky so far, so I'll just leave it at that. So, and so our firm leadership early on, when we decided to, it was late March, we decided to close the office and go full remote. We did that for several weeks, but our leadership was great. Creating videos and messaging throughout all this time, where they would, try to keep us motivated, keep us on task, let us know what's going on. Sometimes it was much harder than other times. Try to create a little fun, but it's something that's very important. Communication between leadership and your people, to make sure everybody knows that they're appreciated. We're all in this together. It's maybe that's hokey anymore, but it's really important that everybody knows what's going on. So we started back in around mid-May, and we did an A and B team, 1 week on and 1 week off, and you would work remote the other week. And then it was about the beginning of August that we decided that, we felt pretty confident that we've created a really good environment, and we now have the office open and available to anyone that wants to come in. And we're about 60% capacity. We usually have about 250 people that are in the building on a daily basis. So we're about 60% of that. We started doing things early on, like sorting and scanning mail instead of just delivering it throughout the day. And we're going to continue to do that. It just works. And there are things that you're going to find throughout this process that you're going to realize this is a better way to do this. And so there are things like that are going to make your business more efficient and make your facility better. Things like this, cold and flu season, we had a really tough flu season in our building. And I think following a lot of these protocols just going forward are going to help with that as well too. So I just want to say thanks. I appreciate it. And I want to say special thanks to Dominic Bonacci, my colleague at the firm, who threw my name in the hat. And I really appreciate the opportunity to be here with you.
Thank you, Ronald. We have one question.
Yes.
What was the name of that product again? I think the self-cleaning product.
Nano Touch.
No touch. Yeah. Thanks.
Sure thing.
Yep. Thank you. Nikki, we will go to Nikki. Start.
All right. Great. Sound check. Everybody can hear me fine?
Yeah.
Awesome.
Yes. At least I hear you.
Well, you're important. Awesome. All right. Well, thank you everybody for having me here. I want to just briefly introduce my organization because a lot of people have not heard of American Institutes for Research, but I'm not going to read what's on the screen. I'm just going to tell you about myself. So my name is Nikki Sharon. I am a Cleveland person, graduated from Case Western Reserve University, engineering for undergrad as well as MBA, attained my PMP 7-8 years ago, and had left the Cleveland area for about 15 years to the DC metro area, which is where I started working for American Institutes for Research, and then came back about 6 years ago and have continued to work for them, but now remotely. I've been in IT most of my career, and now I'm the Senior Director of IT Project Management and Service Delivery at AIR. So 16 years with that organization, and a lot's been happening, and we are also responding differently than what Ron was talking about, but a lot of similarities as well, which is great. We are a research organization, nonprofit. We have 11 offices across the country. So we have similarities in terms of some of the spaces we're in. We're the single tenant, but some of the places we're in a multi-tenant environment. So it kind of does things a little differently. And I welcome you to watch our 1-minute video. The link is in the YouTube when the presentation is posted. All right, so enough about that. Let's get to the real meat of where we're at. So I'm going to talk about a few things. We established a task force, our employee resource groups, the support from IT. We did a pulse survey, talked about the business need of being in the office, and then we've got a training for returning to the office. So I'll just jump right in. So when this all happened, we established a task force. And first it was established in February to kind of prepare, you know, the news was coming out, and it was just some of the leadership to say, all right, what do we want to do? But then in March, mid-March, we did become officially work from home, and the task force moved into a work from home directive and supporting that work from home environment. And a lot happened to that. And then in the last few months, we've now focused on how we're going to return to office, as well as how we're going to continue to maintain our operations, because we're not returning to office until January 2021. Though that constantly gets reviewed, and you know, I won't be surprised if it gets extended a little bit further. It goes back to what Ron stated about we don't know what the vaccine's going to be like, we don't know what the situation's going to be like. So there's still a lot of unknowns. So the task force continues. We have representation from multiple teams, HR, of course, IT, facilities management, the communications team, because communications is key, and our business leader. So we have a few different divisions within our organization, and each of the divisions have their own unique needs. So one of our divisions, it's all research-based. They can do a lot from home or a lot from their office, but we also have a group that does a lot of in-person work and traveling to client sites, working with school systems and different organizations. So that we're having to bounce, adjust with the needs of what our needs are and the requests of our clients. So it becomes a balancing act. So at times we do have some people that need to go in. More recently, about a month ago, we had a small project where we had to do some in-person training, and we were able to figure out a way to make that work. And so that became an authorized as needed approval. So for the 3 days, came up with a plan, executed that plan, and then everybody went back. We have other staff that are going in, with, I hate to say essential workers, but the staff that had to be in the office to do their work, mainly our facilities management staff, because without them, a lot of this wouldn't work. And some of our IT staff that had to go in to get equipment, process, send out equipment for new hires, because we've still maintained that new hire process, but now everything's happening remotely, so we still have to go in the office to build systems, send that out. And then we've had some limited return, and if it's project-based for a short period of time, how do we need to do that? We had another group that needed to be in for a month, and there was like 12 of them, and normally they were in like this open area, shared space. Well, we moved that and had everybody in individual offices. So, and there were some security requirements, so we had to reconfigure some of that stuff. So again, you stop and think, going, okay, how do we do this? How do we protect staff? And how do we continue to maintain the social distancing that needs to happen? And during this time, you know, we've also tried to provide support for staff who are trying to balance, you know, so you're at home, kids are at home, partners are at home, you know, how do you balance what's going on? And how do you, you know, try to keep everybody from getting overwhelmed? So we had a lot of communications. We had our senior leadership team as well as HR say, here, you know what, we're going to give you a bank of hours that we work similarly, because we work on projects where you have different charge codes and you have to allocate your time per those charge codes. So here, we're going to give you X number of hours that you just use at your discretion. If you just need to do it to decompress, take some time off. If you need some hours because you now got to help your kids with their schoolwork and you just can't do it during the normal time, that's okay. As well as we also, you know, said, here, we had core hours, which was generally like 9 to 5. Skip the core hours. Get the work done. Work with your staff manager, and as long as you're making your deliverables and the work is getting done, then you're fine. And really just kind of work around everybody's schedule to see how we can best support staff, especially in the beginning when everybody's like, oh my goodness. And then as things settle down, then we settle that part down too. So it is just really kind of understanding what's going on. And the task force is a place that staff come to, or business leaders bring other concerns back, and then we can work together to problem solve. So one of the things that really we were able to capitalize upon is our employee resource groups. We were already approaching 20% workforce being 20% of our workforce being remote, and since we have staff or 11 different offices and then more remote staff, we were already facing this challenge of how do we better work together and communicate while we're in a dispersed locations. So our employee resource group, the Collaborative Remote Employee Workforce, CREW for short, because that's a big tongue twister, they worked alongside with our Access AIR, which is for the staff who need additional access. Those two teams got together and built the AR Inclusive Meeting Guidelines. And it's just a protocol that's been rolled out amongst our organization, as well as posted on our website, so if anybody else wants to use it. But just really, how do we interact with each other? How do we engage with each other? And then when everybody started working from home, for a lot of people, it was a change in the way they worked. It was a change in the way they interacted. And it can be frightening for many, where you're not thinking about being on camera. Little tips is, hey, if you want somebody to see that you're looking at them, you got to look in the camera and not at your screen. And it makes a difference, and you just don't think about that because you're looking at the screen. And so now it looks like you're looking down, but look at the camera. So we talked about, how do you engage staff? The moderator of each meeting, they need to learn their role. It's a different role, like making sure you're reaching out. If there's somebody not really speaking up, just checking in with them. Talking about microphones and headsets and, raising your hand so that somebody knows. Speak your name in case you're not on video so they know who's speaking. Try to minimize the background noise. And use as many visuals as possible. So this is guidelines that had just started to be rolled out. We made a bigger push to get it all rolled out. And then alongside that, in the beginning, mainly in April, but April and May, the CREW Employee Resource Group started having some team meetings where they talked about the collaboration tools that were available, how to better use them, some of the tips and tricks, some best practices on what you can and cannot do or should not do, as well as many of the employee resource groups started holding pop-up meetings. And the pop-up meetings were just more of a casual, let's, the water cooler meetings. It's now electronic web conferencing based water cooler meetings that then led to more consistent meetings. So one of the pop-up groups that we now have is a parent pop-up group, and it's just different people working together, discussing ideas, just bouncing off frustrations, venting a little bit, but saying, here, how do we balance this? How do we manage this? This is what's been going on. And from there, we've gotten some ideas that have been taken to the task force of how we can better support our staff. So the pop-up meetings, again, start off very casual, informal, but then have led to some of our changes and feedback to the senior management team. So where we didn't know how things would work out, opportunities were available, and our employee resource groups really stepped up and said, here's what we can do to help. Here's how we can engage. We have a good understanding of what our staff are looking for, and not everybody feels comfortable going straight to HR or going to their staff manager. Let's just try it here and see what happens. So that's been very successful for us. With IT, of course, this whole thing, you got to have the right IT equipment to be effective. We announced on Friday, March 13th, that, hey, effective Monday, you're all working from home. Great. Well, now a lot of people were taking that Friday off, or they were traveling elsewhere. What do? We didn't bring our stuff home, or I didn't take my laptop home, or I don't have this, or so that was fine. We said, no problem. So the request came into IT. We worked very closely with our facilities management team, and we took the equipment from their offices and shipped it out. And so everybody we made sure had, so our entire workforce already has laptops. That's a standard issue for us. Because we're already becoming more remote and we've got offices, so a lot of staff traveled between the different office locations, laptops were already our standard. So we sent out monitor, docking station, keyboard, mouse, webcams became a newer standard, and headsets became a more default standard than it had been in the past. So those were two things that got added in that weren't there before, mainly because the business needs were now different. And we really worked and if we didn't have the equipment available or we just didn't have enough, then we put some orders in. In the beginning, as Ron stated, there was a high demand and there was some hoarding going on, so we couldn't get out all the monitors right away. We couldn't get out all the headsets right away. It's now settled down and a lot bit easier, but we wanted to make sure staff were set up as effectively as they could be. And we did slow roll the sending out of equipment because honestly, in the very beginning, we thought maybe a month, maybe 2 months, and then we'll all be back. Yeah, well, that didn't happen. So as this work from home directive stayed in effect and kept being extended, then we've talked about the different ways to accommodate and provide the equipment that they need. IT support also switched to flexible hours. So as our staff were doing work at different times, I mean, sometimes they just couldn't, they needed help, but they just could not make themselves available during the regular business day. We started spending more time after hours, scheduling appointments. So if somebody was saying, hey, I could be available at 9 p.m., then we had a tech available at 9 to assist them at that point in time. It wasn't something that we really did in the past, but the business needed flexibility. Staff member needed flexibility, so IT also provided some flexibility and said, okay, sure. And then our techs also got flexibility with their hours. So some of our techs who are also parents were like, hey, I can do the later hours, no problem. During the business day is a little bit more iffy. We're like, sure, well, we've got staff that need support in the later hours. So the real big thing was understanding what the staff needs were and being flexible to provide that support. And then one of the messages that we kept, we relayed in the beginning, and then we reiterated as the timings changed, was about the bandwidth sharing best practices. So you're now working from home. you got your kids working from home, or your partner and spouse is working from home. We're all sharing bandwidth, and sometimes things just don't respond as well as you think it would, or you don't have the same bandwidth at home that you would have in an in-office environment. So what does that mean? Well, we shared a couple of sites of here, go check how your speed is, what you're going, and then guidance on like the minimums and how to use it. So if you're just doing basic email, basic just browsing, a low bandwidth of 2 to 6 megabits per second, hey, you'll have good response and decent experience. But as you start adding on components like video, webcams, now video streaming, web conferencing, or now you've also got web conferencing and you're sharing your screen, or you've got 6 or 7 different applications open, and you've got all these different tabs on your browser open, that's all taking up memory in your computer, or it's taking up bandwidth. And if your kids are taking classes and they're online, that's eating it up. So we would recommend for our staff, if at all possible, to connect into the Ethernet port in your home router instead of using wireless. Some can, some cannot. And then when the summer rolled around, or like, hey, you know, your kids that are playing Minecraft or Fortnite or whatever else kids are playing these days, that's going to eat up bandwidth while you're trying to work. So that's going to have an impact, because we would get tickets going, yeah, such and such thing is working really slow and it can't get to it, and it's not, you know, it's broken, fix it. And then through conversations and a little bit of troubleshooting, like going to the speed test sites, we're like, yeah, you might want to check what's going on at home. And so we wanted to educate our staff on the tools and the ways to check to see what's going on. Hey, is there really a system problem with our systems, or is this something that they kind of need to manage in their own home environment? So knowing how much you need for what you're doing. So, you know, many of us kind of learned that, hey, I'm in the middle of a meeting, I've got a presentation, or I'm going to be on video conference, let's schedule it, or let's not schedule it when we know that the other members of the family need to do something similar, so that our bandwidth can be better utilized for what we need to do. So this is a great site, and just having this chart posted out really helped our staff, and then reduce the cost to the service desk. So we were happier. I don't have a good transition sentence from that to this, but speaking of staff and what they had going on, about a month ago, in the August-September timeframe, now that kids were going back to school, we had just announced that we're going to extend our work from home directive to the end of the year. We really wanted to check in to see how staff were doing and what they thought was going to happen, where their heads were in coming back to the office and are not coming back to the office. So no, we know we extended it, but were staff really comfortable coming in? So we sent out like a 4-question survey. It was really simple because we wanted the response. We got about an 80%, 85% response rate, which was great. So we really know that it's representing our staff. And the response options were pretty simple. You could say, with the 4 statements that were out there, you can say it's true, not true, somewhat true, or certainly true. So we focused on the certainly true because that's a real positive one. And then said, okay, what does this tell us? Well, for the first statement we had was, you know, am I comfortable returning to the office? Well, only 15% of our staff said certainly true. In essence, 85% of our staff are still not comfortable returning to the office. Various reasons, but they're not. But then given the kind of organization we were like, okay, do you really need to be in the office? So we asked if they really need to be in the office to be more productive than where they are today. And only 6% of our staff said that was certainly true. So 94% of our staff are just as productive where they are than they would be in the office. And I'd hazard a guess that many of them are actually more productive without all the disruptions of being in an office environment and people just stopping in your office and hanging out. But we didn't ask that question. But only 6% said they would be more, that it was certainly true that they would be more productive while in an office. So for us, being the organization that we are, we're like, okay, well, 94% of our staff can be productive, while 85% are not comfortable coming back. We're looking at that and wondering if we're going to extend our work from home directive past our current deadline. And then because we've got staff, we have 11 different office locations. Biggest locations, the DC metro area. We have office in Chicago, in Austin, Texas, and the Bay Area. So places where using public transportation is heavy. So we asked, are you comfortable with the safety of your commute? And only 35% of our staff chose certainly true there. So again, not really comfortable coming back, not really comfortable with their commute into the office environment, and they're definitely still productive where they are at. And for the staff that do have to come in, because we have parking in some of the locations, we've then extended that, saying, okay, if you have to come into the office, go ahead and drive in and we'll compensate that parking for you while you're in that office for that few days or a week or whatever it is. Because we want you to take all the precautions and be careful coming to the office. So we try to address that commute concern, and it's something we're going to keep looking at as we make our decisions about the working from home. But again, one of the messages that we're getting here is we can continue as we are, and it needed to be reinforced through this. Besides just the conversations that we have, having some hard data. We're a research organization, so data means a lot to us. Now we have some data, and we will send out a follow-up pulse survey in a few months, or depending, probably in the beginning of the year if we decide to extend it, or in December, just to see how people are still thinking based on what we're learning in terms of vaccinations and the numbers. So I spent a lot of time on this, but really understanding our staff and their concerns was very important, and to ensure that we are addressing them and putting the right mechanisms in place to support our staff. All right, then, as we spoke, there are some staff that need to be in the office, but as we have this conversation about coming back to the office and how we're making our decision, well, as Ron stated, we're following all the guidelines that are out there. So the federal, state, local guidelines. We're following CDC and what their recommendations are. And to help us with this, we subscribe to a service that provides daily updates. Sends an email, somebody curates that information, checks it for our locations, what's going on, and go from there. We also take a look at, how it's going locally. So our headquarters is in the DC metro area, and we've got 5 offices in 3 different jurisdictions that are within 20 miles of each other. However, each of them is actually different. So for example, in the state of Maryland came up with one order, and then they said, hey, each county you're going to do based on what you need to do, which is similar to what Ohio is doing. Well, the county that our office is located in is stricter because of what their numbers are. So we've had to remind our staff that even though you live in a different county, if you have to come into the office, you've got to follow the strictures that are in place for that county where our office is located. So we're reminding staff of those pieces of information as this happens, and then monitoring it on a regular basis to see what has changed, what's not changing. So if somebody does have to come in, there's an approval process for everybody. You go through that, you send the message over to, the approval comes all the way up from the vice president. So if your vice president of your group has not approved it, then you can't come in. And then we submit the notice to our facilities management team so they know that, hey, a person is coming in, and they can grant them access. So we have badges that we need to use to get into our office buildings. And all our badges are turned off. So once they see the approval, the morning of, our facilities team will turn on the badge. But before they do that, the morning that they go in, a person's scheduled to go in, now they have to do an attestation. Now, this was inspired by the University of Washington, because we talked through doing the temperature checks, we talked through doing many other pieces, but we decided we didn't want to collect that information, and rather just have our staff kind of tell us how they're doing and have them check in with themselves in that morning. You know, are they feeling well? Have they taken their own temperatures and said, yep, I'm still okay to come in? So we just want them to kind of be aware, going, nope, check in with yourself. So they get a notice that morning with a link, and that link process is coming soon, but they'll get a notice saying, here, have you A, B, and C? Are you okay? Are you feeling tired? Are you feeling okay? Do you have a temperature? And if they can say no to all of that, great. We reinforce, make sure you follow the building management requirements. So if you're in our DC office where we're a single tenant, okay. If you are in our Chicago office where we're a multi-tenant environment, then make sure you're paying attention to the signs that the building management team has put in place, so that some of them may want us to temperature check, and you'll have to do that then, because even though we at AIR are not requiring it, if that building is requiring it, then you have to adhere to those rules. If you're not willing to, then please don't go into the office, but if you need to go in, you will need to do that. So it is dependent on the location that the staff member is going to. But if everything's okay, then it will send off a message to the facilities team to let them know that, yep, this person has attested that they are okay and they will follow the guidelines. Go ahead and turn on their badge. So we will do that. And then the last thing that the staff member needs to do, and they don't have to do it every single time, but at least once, is review the return to office training module that we've developed. Now, the components of that training module is reminding everybody that this is a collective responsibility. Ron said we're all in this together. Same thing, it's a collective responsibility. We all have to work together, follow the guidelines, follow our best practices, and take care of ourselves. It talks about how you're going to get to the work site, where again, if you can take the option of driving in, we'll reimburse your parking so that you can do that. Following the guidelines of entering the office building, depending on which building it is. How to protect yourself and others while you're in the office. So wearing the masks and, you know, using the hand sanitizer that's available all across the different office locations. And if you're in your office, you don't have to wear the mask, but if you're in the hallways or you're going from one site to the other, or you're going to one floor to the other, then absolutely. And then the other piece that we added was this, we're all accountable. And the we're all accountable is to really talk about, if you notice somebody not following the guidelines, we wanted to give our staff the tools on how to address that. And, you know, how they could say, remind somebody that they need to follow the rules and please put on your mask. And then as well as if you're the person who isn't following the rule or you forgot to put on your mask, and, you know, just take that feedback in the spirit in which it was conveyed, that we're all in this together, we're all accountable. So I'm going to share really quickly, this is what it is. And it just says, hey, we're all in this together. It's 200% work here. You have to do it. I have to do it. All of us together are going to make it better. So we keep it really simple. Please, thank you, and then just accept the fact that, oh yes, sorry, I forgot to keep my mask on. Let me go get it. I appreciate you letting me know. And the person who has to give that feedback, feel comfortable giving that, because you know the recipient's going to take that in a positive way, as opposed to getting all upset. And then we just reinforce what the current general COVID-19 information is and go from there. So that's where we are today. We're continuing to monitor, see what's happening, hoping that this doesn't last too long, but continuing to say we got to just react to what's happening out there, take care of each other, take care of ourselves, and hope that we all get through this well. So that's it for me. I don't know if there's any questions.
Thanks, Nikki. Yeah, we have a question. How do you address if your coworker microphone headset is not clear? You let them know, but nothing is improved.
So we've had staff, or we've had people submit tickets for their coworkers. And if there's a headset's not working, then it needs to come to IT. We will assist. And so, I mean, I've seen people say, "Hey, can you help so and so? Their headset wasn't clear. I don't know if it's something on my end or if it's on their end, but can you please investigate?" And then we in IT will, step in and see what we can figure out. So it's really been letting opening up the tickets for the other person. And then we CC that other person on there so they know that we opened up the ticket, and they'll get a call from IT. And we know that we've had a lot of people not want to contact IT because they feel like they're bothering us, or, hey, they must be so busy because they're trying to support all of this. But we just say, go ahead and help your coworkers and open up the ticket for them, and we'll reach out.
Thank you, Nikki. Stacy Bush, if you can share the screen. Yeah.
All right. Good evening, everybody. All right. So thanks again for inviting me to speak on some of the best practices for a remote workforce. Just to give a brief intro on myself. So my name is Stacy Bush, and I'm a recruiting lead with Tech Systems. I've been with Tech Systems for a little over 6 years, and Tech Systems is a technology services partner. And what I do is I specialize within the project management space. So I'm helping different project managers find new positions, be able to network in the market. So we work with a variety of different clients. So we've been able to gather a lot of the different best practices that people have been doing post-COVID. So love to be able to share a little bit of this information with all of you guys tonight. So to kind of go over the agenda for what I'll be talking about is a little bit more on the trends that we're seeing in the remote workforce, the importance of how to manage remotely, and some best practices of remembering to consider when you're managing your teams. So as far as the remote work, I know pre-COVID, a lot of companies didn't have a lot of remote workers, but with the trends that we're seeing, the remote workforce is here to stay. Pre-COVID, there was about 30% of employees that were working from home, but post-COVID, it's projected that about 48% of employees will likely to continue to work remotely. And 54% of CFOs are actually looking at plans to make remote work a permanent option. Some companies, I know, like Ron had spoken, Nikki had spoke, that they are starting to go back on site, 25 to 50% of their workforce. But there are still companies that don't have any plans until the end of 2021 to come back on site. And also when it comes to hiring, companies are actually starting to hire 100% remote employees. So that with intent that those employees wouldn't be coming on site or in their offices during the time that they were employed there. So I think a lot of people forget why it's so important to have an effective management style of remote workers, especially before COVID. And like Nikki and Ron had said, it was pretty quick that we had to act as far as working remotely and getting all of our employees up to speed, making sure that they had all of their laptops, computers, technologies. But now that we've had some time to reflect back, it's really important to make sure that we are looking at what changes we need to make sure that we are helping our employees. The reason being is that 46% of employees say that working in the current COVID-19 corona outbreak has actually made them reconsider if they're in the right job. 62% of these employees would also consider changing jobs if their company wasn't actually doing enough to protect themselves during COVID. So employees and potential candidates are definitely going to be judging organizations by how they were treating their employees during the pandemic, which could hurt their long-term brand on that employer. So definitely is very important. So I've actually come up with a couple of best practices for managers to make sure that they are effectively managing their teams. So the first best practice is establishing work hours. So with not having a long commute, the longest commute that you really have is from your bedroom to the kitchen to the area that you work in. Employees are feeling like they always need to be on or need to feel on and available. 37% of employees are actually working longer hours at home, and out of that, 17% are working more than 10 hours per week above their normal working hours. And specifically within the IT space, 11,000 technology workers were surveyed, and 57% felt that they were getting burnt out. So it's very important that their employer feels that their number one job is to reinforce the health and safety and well-being. So just taking a step back to see, hey, do you know what the normal working hours of your employees are? Do you know if they're putting in extra hours or extra time consistently? And making sure that you are encouraging them to make sure that they are detaching from work. So some suggestions would be making sure that they're not responding to emails, or you're not sending emails at night to have them to respond to them. Encouraging them to take their lunch hour uninterrupted. So not answering phone calls, not answering emails, and then encouraging different 15-minute breaks throughout the day so they are able to disconnect a little bit more. So going into another best practice would be establishing the rules of engagement. So I know Nikki talked a little bit about that as far as when you are on a video meeting, making sure that you are using visuals, you are making sure that your headset is working, and you are looking and paying attention to the speaker. But what we're finding now is that a lot of people are really getting tired of all the video meetings. I know for a while it was the norm that you should be on video, but taking a step back and asking, does this need to be a video meeting? Can it just be a simple phone call? Making sure that you are kind of establishing what your employees want, if they want to do consistent video meetings versus not, and making that a suggestion or an option for them. And then when it comes to the expectations, when you're working from home, you're not really having that one-on-one interaction with your manager or your team. So making sure that they understand their expectations, because you might be sitting at home thinking that you're actually exceeding expectations, but your manager might think that you're actually below the minimum expectations. So making sure that it's consistently clear all the time in general too. So when it comes to just availability, since they can't just walk into your office or see if you're on a phone call, making sure your calendar is updated is very important. And then being transparent with your team members on, hey, what time are you available today? And saying, hey, I actually have meetings from 8 to 1 today. From 1 to 4, I'm very available. If you need me in the morning, text me. If you need me in the afternoon, give me a call. Just making sure that you are making yourself available and showing that you are very accessible throughout the day. So this goes into the relationship building aspect. It's very hard when you're not grabbing lunch or grabbing coffee or going to the water cooler together to be able to have those non-work related conversations. Especially as a manager, you want to continue to build that relationship. So make it a priority to ask in the first few minutes of every conversation some of that non-work related information, asking those open-ended questions and really digging in to see how your employees are feeling. As mentioned before, a lot of employees are on the verge of a burnout. So by asking these questions, you'll be able to understand and see, hey, maybe there is something wrong with one of your employees, and maybe they are having some challenges and they need a little bit of extra help. So asking them how they're adjusting, what are their biggest challenges, and really getting them to open up a little bit more. And what we've heard from a couple different clients is is the managers will have a coffee talk on a weekly basis where they keep their calendar open from 8 to 9. That if you want to come by and have a one-on-one conversation or a team conversation, that time's open and available for anyone to stop by. Or having different lunch times where they are available, where if an employee needs to connect with you, then you are available during those times. And then as far as the accessibility and communication part of it, it is being able to utilize the different technologies. So as you can see on the screen, there's a variety of different collaboration tools, meeting tools, co-creation tools, and project management tools. And a lot of companies have been adapting to different technologies specifically during COVID. So I highlighted some of the best rated and rankings as far as some newer technologies or technologies that are very user-friendly. I know personally with Tech Systems, we use a combination of WebEx and Microsoft Teams. And I mean, every day they're coming out with different features and different options too. And then some of the ones that I know were pretty top rated for collaboration tools is Slack. So we actually did a Get With It conference for the women in IT last week, and they actually use Slack for all their communication. So this has been something that's been very nice because it is mobile friendly, it is desktop friendly, it does allow for one-on-one chats, group chats, video calling, and it does have a lot of services that do collaborate together. Another one that was very highly rated was Podio. So it helps with like communication. It helps to organize large stacks of work and be able to help delegate to different employees. And then another one that I've seen, I know PMI has used this as well for some of their social events, is Mentimeter. This is a really cool tool that you can use in your meetings to be able to see live results and be able to have some fun, an interactive, fun presentation by asking different questions and being able to see those results live time. So a lot of people have used those in meetings, workshops, trainings, or conferences too. So I know, like I said, there is a bunch on there, some I've never heard of, and some that I'm sure your companies do utilize, but just know that there are a variety out there, and it is to see, hey, what works best for you and for the company and for your team to be able to manage your projects effectively. And then one of the most important best practices is to have fun. So I know when you're thinking of that, you're probably thinking another Zoom happy hour. I know in the beginning of COVID, that was the norm. It was the only way that you could get your team together and do different team building activities. But now there's a variety of different online resources, different examples and ideas of ways to be able to team build. And I think sometimes we do forget how important it is to team build, especially right now. People are feeling isolated or they don't feel a sense of belonging on the team. So these team building activities can help remind them of kind of being able to get their excitement back and being able to continue to know, hey, how fun it is to be on this specific team. So there's a variety of different examples. Some of the things that I have seen have been different like meditations that you can get for free online. There's different workout challenges. There's different like games. You could do virtual bingo, you could do trivias, and a variety of different things to help with that team building. So just continue to look at, hey, maybe there is something that you could do for your team, and making sure that is consistent, just to make sure that you are continuously helping with the morale of the team. And then as far as just wrapping it all up, just taking a step back to be able to figure out your current state and see where you need to focus. Do you have those clear working hours, the clear rules of engagement and expectations set with your team members? Making sure that you do have that intentional check-in for them, both personally and professionally. And then when it comes to technology utilization, making sure that you can help with trying different things, or trying maybe what's best for you, or asking others what other companies use to learn some new technologies. And then the team building events, making sure that you are doing that on a consistent basis to allow your team to really get to know each other and be able to have some fun, in case some of them are a little bit feeling isolated and need a sense of belonging on the team. So that's all I got. I appreciate your guys' time. And then I think one question just came in.
Thanks, Stacy. Yeah, is one idea.
Mhm.
Another idea to use when reaching out to your teams is to send them personal handwritten notes saying how much you appreciate their skills and contributions. Everyone loves getting a handwritten note thanking them and appreciating their contributions.
Yep. No, I love that. I think that's something that we do take for granted. I mean, I know when you're getting mail and you open it up and you're not expecting it to, it definitely really helps, and it makes you feel a lot better about what you're doing, and they're saying thanks for something that you're doing too. So very good suggestion.
Yeah, back, we'll open the chat if anyone has any questions or sharing ideas. Yeah, meanwhile, I'll go down for other slides. Yeah, for upcoming events on November 11/5/2020, Vision for Project Success Professional Development Day via Zoom. 11/6 Summit 2020 Project Economy Virtual Conference, an event from Dayton, Miami Valley, and Southwest Ohio chapters. 11/11 How to prepare to take the PMI Agile Certified Practitioner PMI ACB exam, and 11/18/20 Women in Project Management Virtual Book Club. All are welcome. All these events can visit the PMINEO.org event list, and you can get more details about upcoming events for Northeast Ohio chapter. How do I keep up with my BDUs? The events that we provide in Northeast Ohio chapter, we have a Thursday technical webinars. We have an evening webinars each month. Projectmanagement.com has a webinars. You can use BMI login is needed to access the content. Podcasts using your favorite podcasting app or on the web. PMI Projectified Podcast. Volistech manage this podcast. Claim your own BDUs for this event, and I'll leave this page and looking for chat. Yeah, seems we don't have questions. Gonna finish now for today. Thank you, Ron. Thank you, Nikki. Thank you, Stacy. Thank you all for attending this webinar.
Thank you.
Bye, everybody.
Bye.
Thank you.